next slide here. So I'll also mention about humanizing capitalism more at a macro level, and a lot of that pertains to financing. And I'll be talking about some of the investing funds that I've developed. I developed an I fund, and now I'm developing or helping to develop a solar fund and another health fund. And the idea is, how does the criteria by which money is invested change the competitive landscape for that industry in favor of the consumer? So my solar fund, managed by Bamboo Finance in Geneva, is looking at what are the companies all along the solar supply chain, whether it's technology, manufacturing, distribution, end user financing, installation, looking at all the different companies in an ecosystem that are making solar energy affordable to low-income communities, mainly in off-grid markets where there is no electricity. So the idea is financing as a tool to transform people's difficult situations. And the other theme that you'll see throughout this talk is, how do you create a new asset class? Let's call it the social enterprise asset class. If you think about the nonprofit sector, so many of if you're a nonprofit, all your core competencies and assets are locked up in that nonprofit business model. And usually nonprofits rely upon grants or donations, and they have to reinvent themselves each year. And it's very hard under tax laws in most countries for them to have earned income. So what I've been looking at is, how do you have the form of a for-profit social enterprise that can leverage off of increasing valuation? That's how all the companies in the world develop now. So how do, if you look at Google, it started out with $25 million, and after it went public, it quickly became worth, whatever, $100 billion. So how do you create a social enterprise that can also leverage off of increasing valuation, but at the same time, how can they have the right control and governance to ensure fidelity to social impact? How can they stay true to their social mission, whatever it is? For me, it's about making products affordable. So this is probably the biggest challenge facing social enterprises, particularly in the medical realm where the margins are so high already. How do you create the right business models with the right people, the right investors, the right corporate governance to ensure pricing for affordability? How do you control greed, basically, in a corporate business model? Okay, so I'll be talking about how to address the pricing disparity and how to reach low-income people, and how you change a whole ecosystem, a whole industry. And I'll give some examples of that. And basically, I'll be talking about three areas. One is reducing price points for health technology. A second one is, how do you create healthcare service delivery models that have tiered pricing where revenues from paying patients support care for those that can't pay, which is really how it is in most developing countries where they don't have health insurance. And then I'll be talking about financing and how you use financing to, again, change the whole ecosystem. Okay. So I got my start working in eye care, and I worked for a small nonprofit called Seva Foundation. It's still around. I'm on their advisory board now, and this is back in the early 80s. And I started working in Nepal and India with Aravind Eye Hospital to develop eye care programs that were mainly cataract surgery. Cataract is the main cause of blindness in the world today, and it has to do with the lens of the eye getting cloudy. Earlier they would they would remove the entire lens and give the patient thick cataract glasses, which in the developing world, 50% would lose or break within a year, rendering them blind again. And so back in the 1970s, intraocular lenses or artificial lenses started to become the procedure of choice for markets in the West, here in Japan, the United States, Europe. And I started getting a lot of these lenses donated, and they helped, and I sent over a lot of volunteer eye doctors to train in the modern technique for lens implantation. And that's how I got my start, by getting many donations of these lenses and helping these programs provide better quality vision than what people were getting with the thick cataract glasses. And what we found is that when we started offering a better result, better quality vision, people started coming for cataract surgery earlier, before they were economically blind, when they could still afford to pay something. And that's how these programs started having cost recovery, and that's when they started to become self-financing. And so it's not like we planned it out that donations would help these programs become self-financing, but that's what happened. And then the donations dried up, and I'll tell the rest of that story in just a minute. So I started working with Aravind Eye Hospital back in the early 80s, and Aravind had a very visionary leader named Dr. Venkataswamy. And I learned quite a bit from him, not so much the technical aspects of eye care, but really how to serve others. His whole organization had a culture of serving others and reaching poor people while serving people of higher economic status in order to gain enough revenue to support the whole operation. And so if you go to Aravind today, it's an amazing place. They have 8 eye hospitals in South India, and they do over 300,000 surgeries a year. I think that's more than what Japan does. And they have a model where about 1/3 pay nothing, 1/3 pay 2/3 cost, and 1/3 pay well above cost. But with that model, even though 2/3 of the patients are below cost or free, they're still able to make a substantial profit. And so I've helped them develop this model and spread it around the world to many different locations. And here's a graph on their growth, and you can see that things really shot up starting in 1992, and that's when we set up a factory to make intraocular lenses, and that's when the whole surgical volume really took off at Aravind and also throughout India and other developing countries. Aravind has helped many programs develop sustainable programs. They've helped over 200, and more than 80% have become self-financing through the process that we pioneered at Aravind. And I've also helped set up different training centers, different living laboratories like Aravind that are examples of programs that are self-financing and then become training centers like Aravind in India, Nepal, China, Bangladesh, Egypt, Malawi, Kenya, Tanzania, all these different countries. So one of the points I wanted to make about Aravind, you know, people think it's counterintuitive. How can you run a business doing everything for free? Well, at Aravind one year, they got maybe 2% of their paying patients from the neighboring state of Kerala. They're in Tamil Nadu mainly. And one year they did 40 eye camps where they went out and did outreach in Kerala, found a lot of cataract cases and brought them back to the hospital to do surgery. The next year, the paying volume coming from Kerala jumped from 2% of the total to 25% because of the buzz or good public relations developed from doing all this free work, and you know, having a lot of poor people come back to their villages with really good vision. That's what helped create the market demand from the paying side. Here's an eye hospital that I helped set up with Dr. Mohammed, Professor Yunus, the founder of Grameen Bank. And we have 2 eye hospitals going there now. And then in Nepal, I created a number of eye hospitals, and this one is in Lumbini, birthplace of the Buddha, which also happens to have a 5-star Japanese hotel there in Lumbini. Good place to stay. And let's see. Okay, there we go. That's the we started out in this really awful district hospital, and we you know, for 8 years we worked up to 5,000 surgeries, and then the Seva Foundation raised money and built this new hospital. And my work was to create a cost recovery plan. So I took what I learned at Aravind, and I helped them develop a plan for charging reasonable fees. And we put the fee structure in place, and in 1 year, when the hospital opened, the surgery jumped from 5,000 to 10,000 in 1 year. And now it's something like 35,000 a year. But everyone was concerned because they thought it was criminal to charge poor Nepalese money. But it turns out that when you charge very reasonable rates and the word gets out, people come from far away knowing that they can be served and that it's affordable.